Hey, you ever notice your dog scratching a bit more than usual, or maybe their coat feels kind of, well, greasy?
It happens.
We're diving deep today into a really common skin issue for our furry friends, one that can sometimes leave us pet owners feeling a little, lost.
Exactly. Today, we're focusing on Malassezia dermatitis in animals.
Uh,
We've gathered quite a bit of information on this topic to help us really get to the bottom of what's happening when those itchy situations pop up.
yeah, our goal for you today is to make Malassezia dermatitis crystal clear what kicks it off, what the signs are that you might notice, how the vet figures it out, and what can be done to help your pet.
Right.
We want you to feel really well informed about this without getting lost in complicated medical talk.
Definitely.
Ever wondered why some pets just seem more prone to skin problems or those, never-ending ear infections? This deep dive is going to shine a light on that connection.
Okay, let's unpack this then. Malassezia dermatitis. It sounds a bit scientific, I know, but what we're really talking about is something involving a yeast called Malassezia pachydermatis.
Ah, right. And didn't it used to have another name?
It did, yeah. You might also hear it called by its older name, Pityrosporum canis.
Okay, so what's interesting here is that Malassezia pachydermatis is actually a type of yeast.
Right.
And get this, it normally lives on the skin, in the ears, and in those little damp spots on our animals.
So it's usually just there.
Yeah. Think of it like the friendly bacteria that live in our own bodies. Usually they're just part of the crew, and don't cause any trouble.
Okay, so it's not like it's an invader all the time.
Precisely. Now, this particular yeast, M. pachydermatis, it really loves lipids, which basically means it thrives in oily conditions.
Oh, okay.
And other members of the Malassezia family are actually lipid-dependent. They need those oils to survive.
Gotcha.
Now, while it's true that when there's a problem, you often see a lot of this yeast hanging around, it's super important to remember that just finding some Malassezia doesn't automatically mean there's a problem.
Right, so when does this normally friendly skin resident decide to, throw a party and cause trouble?
That's the key question, isn't it? The switch flips when this yeast overgrows,
That's right.
and this overgrowth is often a sign that something else is going on under the surface.
Like what sort of things?
Well, we're talking about things like allergies, those conditions that make skin oily or flaky, what vets call seborrheic conditions, and even things pets are born with, what we call congenital factors, and even hormone imbalances.
That makes a lot of sense. So who tends to be most affected by this? Are there certain types of animals we should be especially aware of?
Good question. If we look at dogs, well, really any breed can end up with Malassezia dermatitis.
Sure.
There are some that seem to be more prone to it. Think of breeds like Westies, Poodles, Basset Hounds,
Cocker Spaniels, too?
Cocker Spaniels, definitely, and Dachshunds. So if you have one of these breeds, it's something to keep in mind.
Is it something about their skin structure, maybe? Or their immune systems that makes them more susceptible?
That's a great question. It's likely a combination of factors, really. Some breeds might just have skin that naturally produces more oil.
Creating that environment that Malassezia loves.
Exactly. And others might have underlying immune predispositions that make them more prone to allergic reactions, which, as we'll get into, can sort of pave the way for yeast overgrowth.
Okay. What about our cats? Do they get this as often as dogs?
It's actually less common in cats. However, when we do see Malassezia dermatitis in older cats, it can sometimes be a bit of a red flag for internal issues, like cancers, what vets call neoplasia.
Oh, wow. Okay.
Yeah. And while any cat breed can be affected, young Rex cats seem to be more susceptible.
Interesting.
Interestingly, it doesn't seem to prefer male or female pets in either dogs or cats.
Good to know.
And it's worth knowing that Malassezia dermatitis and a related condition, Malassezia-associated seborrheic dermatitis, are seen pretty much all over the world.
Okay, so if a pet owner suspects their animal might have this, what are the early warning signs? What should they be, on the lookout for?
Well, the most common sign is pruritus.
Which is just the fancy term for itching, right?
Exactly, itching. And this itching can range from just a little bit annoying to, really intense.
Okay.
Visually, you might see erythema, which is just redness of the skin, alopecia, meaning hair loss, and scale, which looks like dandruff or sort of flakiness.
Right.
Greasiness is another big one. And you might notice these changes especially around their lips, inside their ears, on their paws, in their armpits, the axillae, in the groin area or inguinal area, and even on the underside of their neck.
That gives us a good visual. Are there any other signs that might be a bit less obvious?
Absolutely. One thing many owners notice is malodor, just a noticeable bad smell coming from their pet's skin.
Ah, okay. The yeasty smell some people mention.
Could be, yeah. And in more long-term cases, you might see hyperpigmentation, which is a darkening of the skin in the affected areas.
Yeah.
And lichenification, where the skin actually becomes thickened and a bit sort of leathery.
Okay.
Ear troubles are also really common. Pets might have frequent ear infections with that black, waxy, or oily gunk.
Yeah, those ear infections can be persistent.
They really can.
Huh.
And there's also a less common but quite specific sign called frenzied facial pruritus, where the animal seems incredibly itchy, specifically around their face.
Oh, wow. That sounds pretty distressing for the poor animal.
It can be. And often these pets have a history of allergies that just seem to be getting worse. And they don't respond as well to those steroid treatments they might have had before. That's what vets sometimes call glucocorticoid tachyphylaxis.
So what does that fancy term mean for us pet owners dealing with allergies?
Basically, it means that over time, steroid treatments that used to work well for the allergies become less effective at controlling the itch.
Right.
And this can, unfortunately, create a sort of window for the Malassezia to take hold.
Exactly.
Yeah.
And you might also see other things happening at the same time, like bacterial folliculitis, which is inflammation of the hair follicles.
Okay.
Other types of allergic reactions, maybe endocrine disorders, and even that seborrheic dermatitis we mentioned.
So we've talked about who's at risk and what to look for. Let's dig into the why. What actually causes this yeast to go into overdrive?
Yeah, good question. There are several things that can contribute. Environmental factors like high humidity and warmth can certainly make it easier for the yeast to thrive.
Right, like sticky summer weather.
Exactly. But as we mentioned earlier, allergies, things like environmental allergies, flea allergies, and sometimes even food sensitivities are a really major reason why this happens.
So in essence, the allergic reaction can disrupt the skin's natural barrier and its microenvironment,
So it's like,
creating a more favorable, maybe oil-rich environment for the Malassezia to flourish.
you got it. So treating the allergy is therefore not just about reducing itch, it's about restoring the skin's balance and making it less hospitable to the yeast.
So it's often not just a simple case of too much yeast. There's usually something else going on underneath.
Precisely. That's key. Seborrheic dermatitis, especially in young dogs of those breeds we talked about, can also be a trigger. Endocrine problems are suspected as playing a part, although the exact links are still being researched a bit.
Okay.
And we know that genetics are important, especially in those predisposed dog breeds and in Rex cats.
What about other infections? Can they be connected, like bacteria?
That's a really important point. There's often a concurrent increase in a common type of bacteria that often hangs out on pet skin, called Staphylococcus pseudointermedius,
Okay.
and bacterial folliculitis. So it's a bit like, well, it's hard to know which came first sometimes, the yeast or the bacteria.
Right.
The disruption of the skin's natural defenses can make it easier for both to overgrow. Treating one might make things a bit better, but then the other one might become more obvious. It's crucial to remember that anti-yeast treatment will only target the Malassezia signs.
That really highlights how complex it can be. Are there any specific causes we see just in cats?
Yes, in cats, we see this in both young and adult animals. And just like in dogs, it's often linked to allergies.
Okay.
For Rex cats, there's some thought that it might be related to their unique skin and perhaps a tendency towards a mast cell issue called urticaria pigmentosa.
Ah, okay.
And this is really important for owners of older cats. Malassezia dermatitis in this age group has been linked sometimes to serious conditions like thymomas.
Which are tumors of a gland in the chest?
That's right, the thymus gland, and also cancers of the pancreas and liver.
Wow. That's a sobering thought and really underscores the importance of getting a vet involved if you see these signs, especially in an older cat.
Absolutely.
So how does a veterinarian actually determine if Malassezia is the problem? What does the diagnosis involve?
Well, the main thing is to show that there's an unusually high number of yeast on the affected skin, and really importantly, that the signs get better when the yeast is treated. It's not just about finding the yeast. Remember, a little bit is normal. It's about showing that it's the cause of the trouble.
And how do they tell the difference between this and other skin issues that might look similar? Because lots of things cause itching, right?
Exactly. That's where what we call differential diagnosis comes in. There are several conditions that can look a lot like Malassezia dermatitis, such as other kinds of allergic skin problems, flea allergies, environmental allergies, even food sensitivities.
Okay.
A bacterial infection of the hair follicles, superficial bacterial folliculitis, can also look similar.
Right.
As can problems with skin cell turnover, they cause oiliness or flakiness, primary or secondary seborrhea,
Right.
and a condition called acanthosis nigricans, which is something we see more often in dachshunds.
So it's definitely not always obvious just by looking. What kind of tests might the vet run?
Well, standard blood and urine tests are usually normal, unless there's an underlying health issue contributing to the Malassezia overgrowth. The more specific tests focus on actually identifying the yeast. One way is through fungal culture using contact plates.
Contact plates, what are those?
They're like little petri dishes with a special gel, an agar medium inside. The vet will gently press these onto the affected skin, let them sit for a bit, and then send them off to be incubated.
Ah, I see.
If Malassezia is present in large numbers, it will grow into these distinctive yellow or buff-colored colonies. This gives the vet a sense of how much yeast is there compared to what's normal. It's what we call semi-quantitative data.
Semi-quantitative. So like not an exact count, but an idea of lots versus a little.
Exactly. Think of it as getting a sense of how many yeast colonies are growing. It gives the vet a good indication of whether there's a significant overgrowth compared to what's normal.
Then are there any culture methods that aren't as helpful in this case?
Well, just doing a basic culture where they're just looking to see if Malassezia is present isn't very useful because, like we've said, it's normally there anyway.
Right, you need to know if there's too much.
Precisely. We need to know if there's an overgrowth.
So what's the key test then? The one that gives the most useful information?
That would almost certainly be skin cytology.
Cytology.
Yeah. This involves taking samples from the skin in different ways, sometimes just by gently touching a microscope slide to the area, other times by using a cotton swab or even a piece of clear tape.
Okay.
The sample is then put on a slide and stained with a special stain called Diffquick.
Uh-huh.
And here's a little practical tip vets use. Sometimes they might put a drop of the stain directly on the sample to help the yeast show up better, stop it washing off. Gently warming the slide can also help the stain work better sometimes.
Interesting.
Areas that are really greasy or flaky are the most likely to show a lot of yeast under the microscope. You see these little peanut-shaped or footprint-shaped organisms.
Okay, so once a vet has diagnosed Malassezia dermatitis, maybe using that cytology, what can be done to treat it? What are the options?
Well, the very first thing, and this is crucial, is always to try to figure out and treat any underlying conditions that might be allowing the yeast to overgrow.
Right. Address the root cause.
Exactly. If you don't address the root of the problem, the Malassezia is likely to just keep coming back.
Makes sense.
For the yeast itself, the main approach is usually topical therapy, because the yeast mostly lives right on the surface of the skin, in the stratum corneum.
And what does topical therapy usually involve?
Shampoos?
Medicated shampoos are a really important part of it, yes. These shampoos help to wash away the scale and that oily stuff, the exudation that the yeast loves.
Okay.
Shampoos containing miconazole and chlorhexidone have been shown in trials to be the most effective.
Miconazole and chlorhexidine. Got it.
Selenium sulfide shampoos can also help, although they might not be quite as strong, but still useful. Usually, these shampoos are used maybe twice a week.
Okay.
Other medicated shampoos, like those with ketoconazole, can also be valuable, especially when used alongside appropriate oral medications if needed.
Sometimes vets will use a combination of shampoos, perhaps ones that help to gently break down that flaky outer layer of skin, what we call keratolytic shampoos, along with systemic anti-yeast and maybe even antibacterial drugs.
What about pills or liquids you give by mouth? Are those ever needed? Systemic options?
They are, yeah.
Yeah.
For mild, maybe very localized cases, antifungal creams and lotions might do the trick on their own. But for more widespread or long-lasting chronic infections, we often need to use oral medications.
Like what?
Some common ones are ketoconazole, usually given once a day for maybe 2 to 4 weeks. Fluconazole and itraconazole are also effective options, usually given daily as well. Other related drugs, other imidazoles, can also work.
You mentioned before about skin that gets really thick and hard, lichenified. Is the treatment different for that?
Yes, good point. In those really chronic, thickened skin cases, a short course of ketoconazole, perhaps at a slightly different dose, given for about a week to 10 days,
Okay.
along with a good, effective topical antifungal shampoo, can actually be used as a diagnostic tool as well. Well, if the skin starts to improve with that specific combination, it strongly supports the idea that Malassezia is a big part of the problem.
Ah, okay. A therapeutic trial.
Exactly. But it's worth noting that improvement can be slow in these more chronic cases.
Right.
For ongoing management, keeping it from coming back, regular use of those topical antimicrobial or antibacterial shampoos can really help keep things in remission.
Are there any things we should be careful about with these medications? Any potential issues or interactions?
Yes, definitely important. With ketoconazole specifically, although it's rare, there can be liver reactions in some animals.
Okay.
It can also sometimes mask the signs of Cushing's disease, hyperadrenocorticism, and it can interfere with certain tests for adrenal gland function because it blocks cortisol production a bit.
Good to know.
And because of how it's metabolized, it's generally contraindicated, meaning not used, in cats who already have liver disease or severe internal cancer.
Okay. Important considerations there. So once treatment starts, how does the vet know if it's working and when to stop? What's the follow-up like?
Follow-up appointments are absolutely key. Usually the vet will want to see your pet again after a couple weeks, maybe 4 weeks, to check how they're doing physically. And they might do another skin cytology to see if the yeast numbers have gone down.
Right, check under the microscope again.
Exactly. Treatment usually continues until very few, or maybe even no yeast organisms are seen on the skin cytology, or sometimes for about a week after all the clinical signs have completely gone away.
Okay. And how quickly should owners expect to see improvement?
Often the pruritus, the itching, and that malodor usually improve noticeably within the first week of successful treatment. The skin changes take longer, though.
That's good news for the pet's comfort, at least.
Definitely.
And what about the chances of this coming back? Is Malassezia dermatitis something pets are just prone to getting again and again?
Unfortunately, recurrence can be quite common, especially if those underlying issues we talked about, the allergies, the seborrhea, aren't well managed.
Back to the root cause again?
Always. That's why it's so important to get to the bottom of why it happened in the first place. Regular bathing with those antifungal and perhaps antibacterial shampoo combinations can be really helpful in reducing how often it comes back, especially in those chronic cases. Maintenance therapy, essentially.
So, to sort of wrap up our deep dive today, Malassezia is a common yeast that lives on our pet's skin.
Right. Normally harmless.
Normally harmless, yeah. But it can overgrow and cause skin problems, and this is often linked to other things going on, like allergies or oily skin conditions. Getting an early diagnosis from the vet and tackling that underlying cause are really crucial for managing it effectively.
That's a perfect summary, and it really emphasizes why getting a proper diagnosis and treatment plan from your veterinarian is so important. You can't just assume a bit of scratching is Malassezia, right?
No, definitely not.
There could be other things at play or those underlying conditions that really need attention.
Absolutely. Considering how many different factors can contribute to a seemingly simple yeast overgrowth, it really makes you wonder what other seemingly straightforward health issues in our pets might have surprisingly complex roots.
It's a great point.
It definitely makes you think more deeply about how everything in their bodies is kind of interconnected, doesn't it?
It really does. A good thought to end on. Thank you for joining us for this deep dive into Malassezia dermatitis.
Yeah, thanks everyone. We hope this has given you a clearer picture of this common but sometimes complicated skin condition.